Steve, you mentioned a good point of how a lot of patients are flying to other countries like Turkey and elsewhere in Europe and in the Middle East and outside of North America to get a hair transplant. I don't doubt that there are qualified surgeons out there, but if someone is considering trying to go to another country to get a hair transplant because they think they're getting a better deal, what would you recommend to that sort of patient who's looking to travel abroad?
You got to be very careful. Again, going back to if it sounds too good to be true, it probably is. What people don't realize in many of the clinics in Turkey is they're doing literally 24-hour, round-the-clock surgeries. They're doing 20 a day for $3,500 US. And it's just a massive assembly line. And, oh well, if it doesn't work, at least I don't have a linear scar. I mean, Lance, I've seen patients come down from Dallas, excuse me, and have met me here in Austin, that sit in the office and then ask if we can help them. They have visited a clinic that does not specialize in hair restoration. The doctor is a part-time hair doctor. What I mean by that is they're either a plastic surgeon or a cosmetic guy that bought a machine and hung a shingle outside that says, I now do hair transplants. They only do FUE. And oh, by the way, doc, if you don't want to do it, don't worry about it. We'll send in somebody to do it for you, so you don't have to do anything.
So this isn't really a medical professional, this is more of like a technician.
Correct.
Gotcha.
And then what happens is that medical practice pays that nurse, or I'm not even going to call him a nurse, medical assistant, $1 a graft. So the more they harvest, the more money they make for the day.
Gotcha.
So everybody in Dallas gets 2,500 grafts per session. Everybody. They get 2,500 grafts. And they got to do it twice inside of 6 months. So these guys come down and sit down, and it looks like a whole, basket of moths have eaten the back of their head. You can see right through their hair to the scars. They've got 5,000 holes in the back of their heads. And then they want us to clean it up in the way that would be best, which, oh, by the way, was probably the way you should have done it the first time.
Gotcha. So,
there's a sucker born every day. And for whatever the reason is, Lance, and this is why, I have such admiration for David DiMuzio and yourself, and there's a couple other guys out there as well that are helping people. Of course, I'll include myself in that because this is my passion. But it's up to us to make sure that these patients get good information, that don't make these horrific mistakes. I mean, can you imagine, I guess getting a bad hair transplant and wasting your money is a bad thing anyway, but flying to Turkey to do it? And I'm not saying that everybody's going to get a bad procedure in Turkey. If you're a candidate that really needs an FUE procedure, I'm sure there's a few doctors over there that may actually do the procedure that are pretty good surgeons. I don't know that for a fact. I haven't studied Turkey. But it just seems to me like that's a little out there. $3,500 for 3,000 FUE grafts. It makes no sense to me. I mean, Dr. McGrath that did your work will tell you he can't safely pull out any more than 1,500 grafts out of the back of the head. A, he'd have to put them too close together, and which makes bigger holes, and make it moth-eaten, right? Or B, he'd have to go outside the safe zone, which hair is going to eventually fall out anyway. So there's a lot going on. There's a couple guys out there that are, buying the artist robot machine, which, to my knowledge is an automated machine where the doctor doesn't have to actually sit there and inspect the grafts and remove them. They have an algorithm for that. The jury's still out on that. I haven't seen many results that are impressive. And again, if it's just for hairlines or if it's just for scar repair, why not? If that's the technology and if that actually does what it's supposed to do, then maybe that's a nice investment. But to spend, $300,000 for a machine when you have to pass that cost on to the patient, that's not a good decision if I'm helping a patient.